Hello. A lot of us have already heard about the pandemic flu known simply as swine flu, or by its proper name, H1N1. We are inundated with information every day from television, radio, and the newspaper about the ongoing world crisis of the H1N1 flu virus. It makes a lot of us feel disconnected from how we could be impacted locally here in Wayne County. This program, produced by the Wayne County Health Department, will inform you on what to expect during this pandemic crisis here in Wayne County, as well as your role to help protect yourself and your loved ones from getting sick from the swine flu virus. We are exposed to flu viruses every year, so what makes the H1N1 virus so different? Why is the swine flu of national and international concern when the normal seasonal flu isn't? Keep watching as 3 of our local experts discuss what exactly the H1N1 virus is and how it became a concern for not only America, but here locally as well.
A pandemic is where a disease spreads widely and actively, not only among a community, but a nation and ultimately the world.
The H1N1 virus is a novel virus, which is a influenza type A strain, much like our seasonal flu.
First known case of it was in Mexico City, and where it started, but very, very quickly moved into California and Texas almost simultaneously.
The virus appears to attack the respiratory system, primarily the lungs. This one is attacking the lung tissue directly, which means that those that have any respiratory compromises like asthma or lung disease, pre-existing lung disease, have a greater likelihood of suffering some severe complications.
There are people right now that are in the hospital with it, that some of them have no medical condition why they should be there.
Usually in seasonal flu, we see our high-risk population as being those over the age of 65. But what has made this such a unique, novel virus, unlike what we've seen in the past, that it's attacking those younger age groups below the age of 24 and creating more severe illness in that age group.
The age groups that H1N1 appears to be targeting are younger folks. Actually, the number 1 group is pregnant women.
Number 2 priority is 0 to 6 months. They're very vulnerable. And then up to about 14 years of age, that whole age group, and then you add on to that any of those kids who have asthma, diabetes, any kind of upper respiratory problem, they're very vulnerable to this.
So we've learned a few things about the H1N1 virus. It originated in Mexico. It's a novel or new virus that no one has seen before. It attacks the respiratory system and has the symptoms of normal flu, such as fever, cough, sore throat, body aches, runny or stuffy nose, chills, and fatigue. It predominantly affects younger people, mostly below the age of 25, and can have severe consequences on pregnant women and those individuals who suffer from other underlying medical conditions such as asthma, diabetes, suppressed immune systems, heart disease, kidney disease, and again, pregnancy. In the case the H1N1 virus becomes an even deadlier pandemic during this flu season, what can we possibly expect here in Wayne County? How will it affect not only our homes, but our schools and places of work as well? This much we can predict in the case of a severe pandemic where many are sick. Schools may close. There will be a significant burden on the workforce, as well as on the healthcare system. Large gatherings such as church services, sporting events, and movies may be closed for a period of time as social distancing may take place. In the case a severe pandemic occurs with the H1N1 virus, social disruption will be commonplace. But what will be the hard-hitting impacts on us here in Wayne County?
As far as impacts, we could see a significant number of people sick. We could conceivably see some people, particularly in those at-risk groups, that will die.
Any case that somebody comes up with a type A virus, in all likelihood it's the H1N1.
As the cases tend to increase, we will probably practice social distancing. Because of absenteeism rates, some schools may have to close.
Businesses can be disrupted, especially smaller businesses with a small number of employees. We could see impacts on a regional as well as a national scale.
CDC is saying up to half of the nation could get this virus before it's over. So you just take a look around at our economy, and if a third to a half of employees are sick on any given day, the small companies are shut down.
That is a huge economic impact on our citizens of Wayne County.
We all need to be prepared. We all need to understand what H1N1 flu is and how to protect ourselves from it, and take reasonable precautions everywhere we are.
We now understand how a pandemic of a mild or severe nature can affect us in a multitude of ways. But what role do we play in preparing ourselves and loved ones during a pandemic? Preparing for a pandemic is not unlike preparing for any form of emergency, such as a tornado or a blizzard. But preparation is key to riding out the storm, so to say, and making sure that you can do your part in getting through the pandemic. First, and most importantly, is to be informed on the truth of the H1N1 pandemic. There are a lot of rumors out there, and the best information is the correct information. You can learn up-to-date facts about the H1N1 virus through programs such as these, or by going to the Center of Disease Control website. Next, come up with a family emergency kit, which includes all of the basic necessities of life, such as a flashlight, batteries, and medications. You may also need to come up with a supply of non-perishable food and water for a period of up to 2 weeks, in the case you may not be able to get to the grocery, and if vital services such as water and electricity are cut off. You can get a full list of items that need to be placed in your emergency kit by visiting the CDC's website at www.pandemicflu.gov, as well as flu.gov. Most important of all is to properly wash your hands. Studies have shown that flu viruses can live anywhere from 2 to 8 hours on hard surfaces, such as doorknobs, desks, and computer keyboards. Proper hand washing is the most important tool that you can use to protect yourself from the H1N1 flu virus. Wash your hands for at least 20 seconds with soap and warm water. If you are unable to wash your hands, then you should use the best form of hand sanitizer available. Also, sanitize as many hard surfaces as you can, such as doorknobs, to kill viruses and help prevent the spread of disease. Now that you know the basics of preparing for the pandemic, how do you find out what to do if you or a loved one are sick? If you exhibit the signs of flu that were discussed earlier, stay at home. Rather than visit your doctor or the emergency room, call your family physician first. Viruses are spread through contact with other sick people, so you want to avoid spreading the disease to others who may also be sick, especially with more severe ailments. If you already exhibit signs of the flu, there's little that can be done other than to relieve symptoms of the virus, such as rest and staying hydrated. Also, if you have a child who is exhibiting signs of the flu, the best thing to do is to keep them home from school until 24 hours after the fever has broken without the aid of fever-reducing medicine. These are just a few things that we can do to protect ourselves and others during a pandemic. Keep watching as we discuss in more detail what you can do to ensure your health and well-being during this difficult time.
The first and best thing people can do is stay informed about this. The information is changing rapidly.
We never, ever should take our hands to our mouth without first washing them or using the different substances that are out there that you can get in a bottle or a spray to help kill the germs.
Those everyday prevention practices has to do with very good hand hygiene, good hand washing, washing with soap and water, 15 to 20 seconds.
Sneeze into a tissue, not into your hand. Dispose of the tissue. Keep environmental surfaces like countertops clean.
If we did just that one thing, we probably could beat this whole virus.
If we don't do those kind of things, however, the flu has a potential to be very devastating to us all.
Let me give you an example of a school. Every day when a kid comes into every class, they're given a wipe with alcohol substance. They wipe their hands, they wipe their desk, throw it away. Teacher wipes her hands, wipes the doorknobs on both sides, throw it away. Those people who do that, those schools are going to be open a long time.
We are not encouraging schools to close. CDC and the state health department and the local health department are not encouraging schools or businesses to close, but to we're actually working trying to keep those establishments open because we realize the impact that a closure could have on the community.
Many of us may be wondering who the lead agency is during a pandemic. You see, a pandemic is a public health emergency, so here in Wayne County, our local health department will take the lead role in providing up-to-date information concerning your health and safety. Working closely with the Wayne County Health Department will be the Wayne County Emergency Management Agency, as well as Reed Hospital. Together, these agencies will work to inform Wayne County citizens on the best course of action for them to take to protect themselves and their loved ones. We've heard a lot about the federal government coming out with a vaccine for the H1N1 virus, including a lot of rumors. It is important to understand that government officials and scientists are still learning about this new virus, so information changes rapidly. Please take note, a vaccine is underway and will be distributed as soon as possible. There are efforts, however, to focus vaccine distribution to 5 key populations. All pregnant women. All people who live with or care for children younger than 6 months of age, health care and emergency medical services personnel, all people 6 months through 24 years of age, and all adults aged 25 through 64 years who have chronic medical conditions. These populations are at the highest risk for severe complications of H1N1 influenza, and by vaccinating them first, we hope to reduce the impact of the H1N1 flu virus. Once these populations have been immunized, then all people ages 25 through 64 years can begin to be vaccinated. It is important to note that the H1N1 vaccine is not the same as the normal seasonal flu vaccine. They are completely separate vaccines, and seniors, the very young, and those with chronic health conditions should still receive their seasonal flu shots. It is also important for seniors to understand that although they should be one of the first in line to receive their seasonal flu shot, they are not considered one of the priority groups for the H1N1 vaccine. This is because the swine flu does not affect senior citizens as adversely as it does those in the target groups just mentioned, as seniors may have built up special antibodies within their system to fight off infection from the H1N1 virus.
We have a plan in Wayne County that if we had enough vaccination, we could actually vaccinate Wayne County, 67,000 people, in 5 to 7 days. However, this supply of vaccination isn't going to be that. We're not going to get 67,000 doses all at once.
When a vaccine is available, we're encouraging folks to get vaccinated. There are some groups, such as the pregnant women and the younger children, that are targeted for vaccination. So when the vaccine program starts to roll out, those people will be the first that will be offered the vaccine. As more vaccine becomes available, we're going to encourage everyone to get shot.
Prevention is the key in preventing spread of the H1N1.
This is something that we as human beings can actually have a tremendous amount of control in if we do very simple things like washing our hands, keeping our hands clean, keeping things around us clean, taking care of those around us. I think we can get through this just fine.
We're going to beat this thing. We're going to do a lot better job beating it if we do what we know and use common sense and wash our hands and keep our surfaces clean. We're going to beat it without any problem. If we don't do that, we're still going to beat it, but it's going to be a lot harder.
I hope that this program has been helpful and informative for you so that you may better understand the H1N1 pandemic flu. You've learned what the H1N1 virus is and how it affects us now and may affect us in the coming months. You have also learned some of the things that you can do to prepare yourself for the pandemic, as well as what you can do if you or a loved one is sick. Finally, you now know that the Wayne County Health Department is the lead agency in Wayne County during a pandemic and is available to contact if you have any questions about your health or safety during a pandemic flu. We will get through this. We will beat the pandemic flu. Knowing the facts and being prepared are essential to protecting yourself from the H1N1 virus. We can provide the information and means necessary to equip the citizens of Wayne County. When available, we will also provide the vaccine to protect our bodies from the pandemic H1N1 influenza. The rest is up to you.